Hello, I'm Bob Challoner, the President and CEO of Southampton Hospital, and I'd like to welcome you to another edition of Focus on Southampton Hospital, our monthly program about the events and goings-on at your community hospital. Today I'd like to welcome Dr. Gregory Davis, who's a periodontist on our staff, who will talk to us about dental health, periodontics, and what we all need to know about the specialty. So good morning, Dr. Davis.
Good morning.
Nice to see you, or good afternoon whenever this is showing, or good evening, because sometimes it's in the middle of the night.
Thank you for having me.
But tell me a little bit about yourself first, how you ended up in the field of periodontics and your training, and then I'm going to ask you, what is periodontics?
Okay. Well, for starters, I've wanted to be a dentist since about the age of 5, to the surprise of everyone who knew me.
You were not one of those children who were frightened away by the dentist?
No,
obviously.
for whatever reason, I thought it was a very cool place to work and to play, and it looked like an interesting way to combine using your hands and working with your hands and helping people and getting into science, and those were areas that I was drawn to. And so it made sense to me from a very early age. So I've sort of been pursuing that directly for many, many years. When I finished high school, I went on to college at SUNY Albany, and from there to Harvard School of Dental Medicine, where I spent 7 years pursuing my dental degree and my 3 years of specialty training in periodontics.
Okay.
And have
Did
been
you train up near Cambridge or Harvard as well?
Mm-hmm.
The residency?
Yeah, Harvard has they have a residency that is based in the dental school.
Okay.
But you also work out of the area hospitals like Children's Hospital in Boston and Mass General Hospital and the VA hospitals as well. So there's a tremendous amount of opportunity. If there's one thing they do well, it's open doors.
Yeah,
and you get a lot of experience, and the experience is whatever you really want. They custom tailor a training program for you, which is unique.
So what brought you to the South Fork?
I grew up on Long Island. I'm originally from East Meadow, which is central Nassau County, but coming out to the Hamptons was something that people in East Meadow never did.
Okay.
It just, we had beaches. We didn't need to come to the Hamptons.
Exactly.
But at some point in time when I was in Boston finishing my residency and planning on coming back to New York, it was suggested by a friend of my dad's that we take a look as far east as we could to see whether that was a place we might consider practicing, because it was a nice lifestyle, and that we might come to appreciate that later on. It might not be as obvious now, but so we kind of thought, well, his hindsight can be our foresight, and we took advantage of that. We came out here and fell in love with it, and we've been out here for 22 years.
Well, I'm glad whatever attracted you out here, that you're out here, and hopefully you have found that lifestyle to go along with the practice.
Absolutely.
Great. Tell me about periodontics. It's one of those specialties in dentistry. Not a lot of people know about the specialties in dentistry, and periodontics specifically. What is it, and what does it entail?
Well, periodontics is that area of dentistry that deals mostly with the supporting structures of the teeth, which are the bone, the alveolar bone, and the gum tissue. And what we focus on now is actually a little different than what traditionally was periodontal disease in the past, which was basically treating disease, which was gum disease, gingivitis, periodontitis, which is loosening, loss of bone, loosening teeth, infection in the gum, bleeding gums, things of that nature. Now we're a lot more preventively oriented, and we're hoping to get people much more proactive about their oral health so that they take a more keen interest in doing the preventive measures, brushing, flossing daily, which is the #1 easiest thing people can do to improve their overall health.
Let's talk about that a little bit, the dental hygiene. I mean, from a young age, from the moment we start going to the dentist talked to us about dental hygiene and the steps that we need to take. And yet, even as an adult, I know myself, I'm still being lectured on how to properly floss and brush, and most of us don't seem to get it. Why is it so important?
Well, I think it's in part, that's a good question. I think in part it has to do with the fact that we're not really paying as close attention when we're being instructed. Sometimes we're lying back and, the light's shining on our face, and our mouth is open, and maybe there's a mirror in our hands and somebody's working in our mouth. And if you could see the view that we see when we're looking through our magnifying glasses and what we're seeing, it would be a lot easier for the average person to understand. But I think the difficulty comes from the fact that it really is difficult to find time in a busy day to spend a few minutes flossing your teeth, which is what it takes. It takes a few minutes to brush your teeth.
Right.
It takes time. Most people are working hard. They've got kids, they've got careers, they've got personal obligations, family obligations, and it's hard for them to find the time, and oftentimes it gets a very short span of attention in their day and a low priority, and they do it in a hurry, and they just do it to get it done, and flossing often gets neglected.
And what happens, what lack of flossing, what does that lead to? What is the sort of the progression?
Well, flossing is really a way of cleaning the tooth surfaces that exist between teeth.
Right.
Now, if you look at what the surface area available to a toothbrush is, it's just a little more than half the available surface area in the mouth, which means that half the surface area is trapped between the teeth where only floss goes.
Right.
So if you're brushing and not flossing and you think you're cleaning all your teeth, it's like only cleaning half your teeth.
Okay.
And all that surface area and all that intimate contact of bacterial plaque that forms undisturbed if you're not flossing in contact with the gum tissue creates a real bacterial burden on your immune system and a lot of toxins that can be readily picked up by inflamed gum tissue and transmitted throughout the body.
So once a day, every day, basically.
Once a day, every day, it's enough.
Right.
It's enough if it's done right.
Right.
It's more than adequate.
Okay. Now, I've heard some people say that flossing, it hurts, especially if you haven't been doing it for a while, or it can bleed a little bit. Is that to be expected?
It is to be expected. If you haven't been flossing, there's going to be a little speed bump along the road where it's going to be a little uncomfortable. You're going to get a little bleeding, but it is going to stop. In the long run, after a couple of days of flossing, it becomes less and less the healthier your gums become.
Right.
The less you floss, the more inflamed they become. So it becomes a sort of a vicious cycle. You don't floss because you're inflamed and it's tender. If you don't floss, it gets more tender and more inflamed. So it doesn't really ever get better.
So it's that inflammation process that really is what starts to trigger the gum disease?
It is. It is.
And as we get older, I've noticed a few things. My gums seem to be receding a little bit. I've noticed it seems like the spaces between my teeth are getting bigger. I don't know if that's true or not, but it seems like food gets stuck a little bit more often. And what's that about it?
Well, as we age, we're always in a state of flux. Things are always changing in the oral cavity. Teeth are moving slightly, especially if we have habits that can contribute to that. People who grind or clench their teeth tend to precipitate a higher degree of tooth movement. So the teeth are moving a lot more in patients who grind and clench. And in any patient or any individual that has any kind of bone loss, periodontal disease, that further weakens the stability of the tooth and allows for more movement in normal function from chewing and speaking, as well as when they're grinding and clenching their teeth. So teeth gradually shift over time as the parts sort of wear down.
Okay.
But there are things that can be done along the way to help prevent that and to compensate for that.
Now, does a periodontist do general dentistry as well, typically? Or?
Typically, no. We're always available to help someone in an emergency, but fillings and crowns and root canals and dentistry of that nature is usually left to our colleagues in the restorative fields and in the other areas, other specialty areas of dentistry.
And at what point would a general dentist then make a referral to you? What are the sort of things that they'd be looking for that they would trigger a referral to a periodontist?
Well, typically the signs of periodontal disease would be bleeding gums, red puffy gums, bad taste in your mouth, bad breath, history of gum infection. History of loosening teeth, shifting teeth. My bite feels different. Things don't feel as comfortable when I chew. It hurts to chew certain foods. Those are the kind of early indicators that will tip off a patient that they have periodontal disease. But the biggest problem is that none of those really have to be detected in a patient. Oftentimes, periodontal disease does not present with anything that a patient is aware of, and you have to be properly checked for periodontal disease by your dentist or periodontist. And that kind of an examination involves measuring under the gum the depth of the pockets and assessing the mobility of the teeth and combining a thorough clinical exam with a radiographic exam with x-rays to see if there's bone loss and to see what the periodontal health is and decide whether a referral is appropriate at that point.
So loosening of the teeth is a sign?
That's a very good sign. Mm-hmm.
Okay.
Absolutely.
And What can be done? I mean, once you start to, what are the tricks of a periodontist?
Well, you know, we always like to begin with, depending on the severity of the disease,
Right.
oftentimes it can be managed non-surgically. There are deep scalings that can be done with local anesthetics that can be very effective at removing the plaque, removing the tartar from the roots, and encouraging the gum tissue to shrink. When there's been a lot of bone loss, or if there's pocketing around the gum, where the gum is loose around the tooth and there's a space that's too deep
Okay.
to clean properly at home with floss and a toothbrush, those areas tend to not respond and resolve as efficiently from a non-surgical approach. And sometimes the gums are lifted away so that the roots can be cleaned better and sewn back around the teeth so they fit tighter, so they fit much better.
Actually can be sewn tighter around the teeth.
Yes, it's like losing weight and
Yeah.
having clothing that's too big. Your
Yeah.
gums can become too big for your teeth and they need to be tailored back to fit again.
Wow.
Also, gum tissue is not the only part of the picture. The bone is what actually supports the tooth and keeps it firm in the mouth. And a lot of times the bone can be regenerated. And when bone is regenerated, you can actually improve the stability and the longevity of a tooth by
Regenerated with...
regrowing lost bone.
Oh, really?
Using cadaver bone, using bone from all different sources. There's synthetic bones available, cadaver bone, bovine bone from cows. There's a lot of there's growth factors now that don't even require bone, that you just use a growth factor soaked in a collagen sponge that can help regenerate lost bone.
Really?
So we have a lot of interesting things that have come down the road in periodontics that weren't available 10, 15 years ago.
I think there's this assumption on a lot of people's parts that over time I'm just going to age and my teeth are going to get looser and fall out and there's really nothing, and it's inevitable that we get dentures.
Right.
It's really not true, is it?
Well, no, that's a myth, and there's really been a paradigm shift in dentistry. If you went to dental school 100 years ago, that was most certainly true,
Right.
because the specialty of periodontics hadn't even come into existence.
Okay.
And most patients at that point, and as well as most dentists, didn't have the tools to understand how to prevent or treat. Nobody was using dental floss. Certainly, you know, most patients were lucky if they got into the dentist once or twice a year.
Right.
And we know that's not adequate for most adult patients. They need to be seen probably closer to 3 or 4 times a year.
Really? 3 or 4
Uh-huh.
times, yeah.
And people don't need to lose their teeth. The reason people lost their teeth was because they weren't going frequently enough to the dentist,
Okay.
because they weren't using dental floss, and they weren't getting their gums treated at an early stage when the teeth could have been saved.
Right.
And everybody just waited for them to get so bad that the next treatment plan was to remove them, make a partial denture. When those teeth got loose, remove them, make a complete denture, and then you're sort of at the end of the road. And the only silver lining in that cloud was that people were under the misconception that now they no longer needed to see their dentist because they had dentures. And that is one of the biggest myths in dentistry, and something that we've become very interested in spreading the word about.
Why would they need to see a dentist when they get dentures? I've thought that too.
You would think
myself.
not,
It's like,
yeah.
oh, that's-
Finally, I don't
that's
need to
done.
go to the
My teeth
dentist.
are going, all
Right,
right.
but the problem is that even when you have a set of dentures, the jaw bones beneath the dentures actually shrink and change over time.
Oh, really?
And the body is in a constant state of decay,
Right.
and as such, the mouth is no exception.
Okay.
As the jawbone shrink and the gum shrinks, the fit of the denture changes. It's no longer as retentive, it's no longer as functional when they chew and speak, and it needs to be relined periodically.
Right.
But even more importantly, one of the big risk factors in not going to the dentist is missing an early diagnosis of oral cancer.
Oh, really?
Many denture patients can develop an oral cancer that would go undiagnosed until way too late to be able to be having a favorable prognosis. And so the best message that I could send to denture wearers is if they haven't been to the dentist in a while, to please go
Right.
and get checked. It's a painless 5-minute exam.
Right.
Oftentimes the people that lost all their teeth and needed dentures lost them because they might have had habits like cigarette smoking, which can really exacerbate periodontal disease and cause aggressive bone loss and tooth loss.
Right.
And those patients are at so much higher risk for oral cancer, their need is much greater to be evaluated frequently.
I was going to ask you about some of the habits associated with smoking and diet. Are there, smoking just in healthcare, we know smoking is not good for anything, but it's same, I guess the same for gum disease and health as well?
Smoking is not good for anything.
Right.
Smoking causes, nicotine causes vasoconstriction, which causes a weakness or an inability for the bone metabolism to maintain healthy bone around teeth,
Right.
and so the bone dies off. And as you lose bone around teeth, teeth become loose. As they become loose, they become infected. As you get a pocket, you get a deeper space, you get infection, you get more bone loss, and the destruction becomes a vicious cycle. Okay. So smoking is not only a risk factor for oral cancer, but it's a risk factor for teeth. It's also a risk factor for dental implants. Okay. So we're very aggressive in trying to get people to stop smoking. New York Quits has been very helpful in providing support for our patients who are trying to quit smoking. We make referrals for acupuncture, for hypnotherapy. Yeah. I mean, we'll try anything to get somebody to stop smoking because we feel it's that important. We even send flowers to people when they've successfully stopped because we're so happy. Exactly. Forget about them. We're excited, and that's a beautiful thing.
Yeah, I guess it's the first site of impact for smoking is probably the mouth, so you probably see it immediately. What about diet? Any recommendations or thoughts about diet, and how does that affect your clearly, I mean, we all grew up with don't eat candy and sugary snacks, but are there other things we can do in diet to improve our gum health?
Well, certainly a healthy diet is important. Vitamin C and the B vitamins are very important in the metabolism of collagen and maintaining good gum tissue health. In fact, British sailors used to carry limes on board their ships. Because they needed vitamin C to keep their gums healthy, and they started calling them limeys for that reason. And it was nothing more than preventing the disease scurvy, which is a condition that afflicts the gum tissue because of the high rate of turnover due to a lack of vitamin C. So vitamin C, the B vitamins, very important. Calcium for people, beyond a certain age is very helpful for those who would be susceptible to osteoporosis, and just a well-rounded diet. I mean, your body needs what it needs, and your mouth is no exception. And healthier foods typically require teeth to chew with. You can't effectively chew raw fruits and vegetables with dentures.
So
it's very hard.
Good thing. I hear some people say that my mouth is sore, and so I'm eating a lot softer foods. Is that good or bad?
I think that's ultimately bad because softer foods tend to be high in starch and carbohydrates and not necessarily the best kind of food to put in the system. And unfortunately, it's a real problem. And sometimes it's sad because sometimes the problem doesn't really manifest until old age when people no longer have a choice and they're maybe in a nursing home or they're hospitalized long term and they really can't enjoy food because they just don't have teeth, or their teeth have been left at home while they're away so they don't get lost. And it's an awkward situation. People who have their teeth in their latter years, I think, are much happier and much healthier.
I've heard it said, I don't know if this is true, that keeping your teeth actually does prolong life over time. I think there have some studies on that.
I would think so. I know that the physician Michael Roizen wrote a book called Real Age, which was a fascinating read. And one of the interesting things that I found in there was that dental flossing increases your lifespan by 6.4 years.
6.4 years.
6.4 years. They have it right down to the 0.4 years. And the reason is clearly that anything that helps reduce a chronic inflammatory state in the body reduces so many other risk factors: risk factor for cardiovascular disease, risk factor for stroke, risk for cancer, risk for complications with diabetes and chronic obstructive pulmonary diseases and pregnancy. So many factors are relevant to so many other conditions that can be so life-threatening. It makes no sense not to keep your mouth healthy.
I've heard that there's a connection with oral disease, gum disease, and heart, and I've never totally understood that. It doesn't seem an apparent link, but what's going on there that would causes that link?
Well, the heart is just another part of the body connected by the circulatory system. Bacteria have the ability to enter the bloodstream and on a regular basis through inflamed gingival tissues. And so there's a constant bacteremia that goes on in the body in a patient that has any kind of periodontal disease. Those bacteria typically produce endotoxins, which are quite destructive. They cause blood clotting, which can cause a stroke or cause blood to collect in areas where you'd rather not have that happen. And you can also find that heart lining, the heart endocardium, the lining of the heart, can become infected and colonized by bacteria that way. If you have an artificial valve that's been replaced in your body, typically you can develop a vegetative growth on that valve from oral bacteria that have penetrated in the bloodstream. There's a lot of good reason to keep the mouth healthy, and that's the rationale behind antibiotic pre-medication for those patients that do have heart valve replacements or do have joints replaced that whose physicians require them to be taking an antibiotic before a dental visit because they want to prevent the transient bacteremia from a dental procedure getting into the bloodstream. But by the same token, that bacteremia is occurring the other 364 days of the year when you're not going to the dentist.
Right.
And so it would behoove anyone to keep their mouth as healthy as possible.
One of the new areas I know that we're hearing a lot about are dental implants and dental implant technology. And I guess a couple of questions for you on that. Is that something that a periodontist does? First of all?
Absolutely.
And just describe the process. What exactly is a dental implant? It's not a denture, clearly. It's something that's permanently affixed, I guess. So.
A dental implant is essentially a titanium post that is screwed into the jawbone that allows you to anchor either a tooth, a bridge, or what's called an overdenture, which is a denture that would snap on or clip on to a substructure affixed to the implant. So the implant allows you to have solid support and retention that would not otherwise be possible without it. And you can replace one missing tooth, multiple missing teeth, or an entire arch or an entire mouth of missing teeth.
Really?
And there's so many different ways to go about it that they've come such a long way in helping so many patients that have lost teeth due to many different conditions, not just gum disease, but...
And how is it different from a crown?
Okay. A crown is typically made to fit over a tooth that has lost a significant amount of its structure.
Okay.
And the crown is a prosthesis that replaces the missing tooth structure, which was typically to decay, lost to decay, or lost to breakage, like a fractured tooth, or something that was traumatized if somebody got hit in the mouth.
Right.
But a dental implant is just the post in the jawbone, and a dental implant also receives a crown on top of it when it is ready to be restored. So crowns are not exclusive to teeth. They're just how we restore missing tooth structure on a tooth root or on an implant
Or on
root.
an implant.
Right.
How process for getting a dental implant? It sounds, is it multiple visits, a long process? What's involved?
Dental implants are a gift to dentistry.
Yeah.
They are by far and away the easiest thing we do.
Really?
And it shocks patients. The most common comment I hear after a patient's had a dental implant is, if I had known it was that easy, I'd have done this 20 years ago.
Right.
It's more like getting your teeth cleaned than
Really?
anything else we do. It's 1,000 times easier for a patient than, for example, having a tooth pulled.
Right.
And if a dental implant's going in, it means the tooth probably came out or never came into that spot.
Right.
And that doesn't seem to be a problem for most people. Dental implants are easy, they're painless, their success rate is higher than any other procedure we do in dentistry. They are very compelling.
How quickly can somebody go back to chewing normally once they've had a dental implant?
Well, in a perfect world, we like to allow a dental implant to have some time to what we call integrate with the jawbone. That is to allow the jawbone to biologically invade the surface of the implant and really lock it into place.
Okay.
And once that process has happened, we call that osseointegration. The implant is now fused with the jawbone.
Wow.
And once that happens, you can connect anything you want to it, and you can chew on it, and it's great. The day an implant is put in, it's strong in the bone, but over time, biology dictates that the bone goes through a remodeling phase around the implant surface, and for a while it gets a little softer, the bone, and then it gets harder again. If you put too much strain on the implant at the wrong time, it can cause a premature failure of the implant.
Okay.
So we don't like to push the envelope too hard, and if we're going to put a tooth on an implant right away, oftentimes we like to keep the occlusal load very light so that it's not seeing an excess amount of force.
It gives an opportunity for it to really bond.
Yeah, it needs a little time to heal. Like any wound, it should be allowed to heal. And once it does, it's fantastic.
Why would I get a crown instead of a dental implant or vice versa? What's the...
Well, we're still about teeth.
Right,
Dentists are
okay.
still about teeth. And if you have a tooth and it can be saved by making a crown, I don't think anybody would argue with removing that tooth in favor of an implant.
Okay.
However, if that tooth needed a root canal, we would also recommend doing the root canal.
Right.
If a root canal was not successful, could not be successful because the roots are calcified or because the tooth split or there's something structurally wrong with the tooth that makes its long-term prognosis not suitable for retention, then it's an ideal application for a dental implant because you don't have to go without a tooth and you don't have to cut down two adjacent teeth on either side of a space to make a bridge.
Okay.
An implant is a great way, it's a very elegant solution to keep a one-tooth problem a one-tooth problem.
Okay.
You lose one tooth, you don't have to involve the other two on either side in order to replace it.
Interesting. And so, some people I know will have dental implants as they get older. The top of the teeth wear down, or something. Is that a more common procedure these days to actually replace teeth at a certain point in life?
Well, like I said, if the teeth can be salvaged,
Right.
we certainly love to save teeth. But oftentimes, patients that have teeth that have worn down beyond repair
Right.
have options where sometimes an implant replacement makes a lot of sense. Dentures and prostheses that over time have changed in their fit and no longer provide retention because the jaws have become so atrophic benefit from dental implant support.
Okay.
And so dental implants help in so many different situations. Not only that, but it also gives us a way out of maintaining chronically infected teeth,
Okay.
strictly for the purpose of retaining those teeth,
Right.
when in fact the body would be much healthier without them.
Right.
And so there comes a point in time where you want to reduce your risk of infection and you reduce your risk of cancer and heart disease and all these other complications that can happen, infection of valves, infection of joints, by getting rid of those diseased teeth, getting rid of the infection, and putting in a healthy implant.
Interesting. And some people I know will actually, is it done cosmetically, dental implants at all, or is it typically more of a, because there's an underlying issue or problem?
Typically it's an underlying problem. Sometimes it's a cosmetic solution. If someone's already in a denture, for example, dental implants can provide support that will allow a denture to be properly made that will give the support to the lips and the cheek that will create that quote-unquote internal facelift that you see sometimes advertised,
Right.
which is nothing more than having the right support from underneath so that
Okay.
the creases, the nasolabial folds, and the wrinkles around the corners of the mouth and the drawn-in cheeks can be filled and plumped out.
Okay.
And sometimes you just can't get a denture to do that because
Okay.
there's nothing to retain it, but a couple of well-placed dental implants can give the support and stability for that prosthesis to work.
Right. I have to ask this question because everyone that's watching, I'm sure, is wondering, does it hurt? What is, it's often the thing that scares most of us away from the dental chair, is that fear of pain, but I know there's lots of things you can do, so.
Well, first of all, dental implants are relatively painless.
Right.
So that's the first thing that I'd want anyone to know.
Okay.
And I think that's something that's very important because most people, if they were to ask the average person on the street, the assessment would be, oh, I heard those things are really uncomfortable.
Right.
And it's just not true.
Right.
So dental implants are not at all painful, but modern dentistry has so much to offer.
That's right.
We have patients come in and, we wrap them up in fleece blankets and we give them an iPod to listen to and they have nitrous oxide to relax them. They can watch TV, listen to music. If they want to be put to sleep, we can have an anesthesiologist come in and
Okay.
give them IV sedation. They go to sleep, they wake up, it's all done.
Right.
They love it. It doesn't have to be unpleasant or uncomfortable. In fact, most of our patients are surprised at how easy things really go.
Not quite a spa day, but almost these days.
Well, yes,
Exactly.
not quite a spa day. At one point, we had somebody coming in doing foot massages.
Oh, very nice.
we tried.
Very nice.
We tried.
I may volunteer to have dental implants.
There you
just for
go.
that
Well, we'll
reason,
make
so.
sure there's someone there for that.
Well, we're almost out of time, but I just want to thank you, Dr. Davis, for just being here today and the great work that you're doing in our community. We're lucky to have you.
Thank you
It's
very
also
much.
been nice to be able to actually talk back to my dentist. Usually my mouth is full of
It's a one-way
things. I can't talk.
conversation,
Exactly
yeah.
right. So thank you very much.
You're very
And,
welcome. Thank you.
For all of you who've tuned in today, thank you for watching. If you have any questions, would like to follow up with Dr. Davis about his practice or any of the items, I know his number will be displayed. Or if you need any help navigating the healthcare system here on the East End, please feel free to give my office a call at 631-726-8555. As always, I'd like to thank our friends at CTV for producing this show and our friends in East Hampton at LTV for showing it in the East Hampton communities. Good health, everyone.